Hello. Thank you for your service to the City of Calgary. I'm Dr. Ann Gillies. I want to speak on the subject of conversion therapy ban. I have an undergrad and a Master of Art in Professional Counseling and a Ph.D. in Philosophy of Professional Counseling. I also have certificates in Adult Attachment Theory, and Emotionally Focused Therapy. I have 25 years of clinical practice in treating those with complex trauma. The proposals to ban conversion therapy are based on false and unproven assumption. And what are these? Firstly, that sexual orientation change therapies cause harm, and that sexual orientation is immutable and unchangeable. Research in this area has conclusively proven that sexuality is fluid, yet conversion therapy bans target those with unwanted same-sex attraction. In 2002, a pair of researchers named Schildo and Schroeder started a study and entitled it Homophobic Therapies, Documenting the Damage. Well, immediately it looks like a bias when they say homophobic. Are they talking about therapists who treat those with unwanted same-sex attraction as being homophobic simply because they treat individuals? It sounds like it. After the first 20 participants, they chose to change the title to Changing Sexual Orientation. And why did they do that? Well, these individuals expressed relief in talking about their unwanted same-sex attraction. They had increased hope and new insights. They had more effective coping strategies. They had increased self-esteem and a new sense of belonging, as well as improved relationships and increased spiritual and religious feelings. Another study in 2006 showed very positive, significant changes with respect to psychological well-being, especially with regard to self-esteem as a result of change efforts. A significant number of other studies have reported positive outcomes. This casts serious doubt on claims that same-sex orientation change therapies cause harm. It is well known in the mental health field that any type of psychological treatment can result in unwanted outcomes, including the potential for perceived harm, complete failure, and possible relapse. Leading researcher Dr. Lisa Diamond, herself a lesbian, has said it's not scientifically accurate to describe same-sex orientation as an immutable trait because it means unchangeable. Immutability of same-sex orientation has been thoroughly disproven by research. A final reason to set aside arguments based on immutability, she says, is that these arguments misrepresent and marginalize sexual minorities who experience their sexuality as chosen, non-exclusive, or variable. Sexual orientation, she goes on, is not biologically based like eye and skin color, but is awareness mediated. She also challenges LGBT activists to quit promoting the Born That Way myth. So here's the dilemma. Science supports sexual flexibility and fluidity. But the bias of this ban is that individual therapists will only be allowed to help individuals resolve same-sex attraction in one direction, toward a gay and lesbian identity. It is important to note that all of the symptoms identified in some studies on same-sex orientation change efforts are identical to symptoms found in complex trauma suffered in early childhood. These facts point to the need for further study before we can make any decision on banning therapies that can actually help individuals resolve issues of unwanted same-sex attraction, as well as resolving trauma. Thank you for listening.